Yeah, first and foremost, a stroke is a decrease of oxygen to the brain. That's caused by two different reasons. One could be a blockage, which we would call an ischemic stroke. The other would be a hemorrhagic stroke, where there's a bleed in part of the artery and then the blood no longer makes it to a part of the brain. Ischemic strokes happen more often, about 85%. Hemorrhagic strokes only about 15%. So the bleed in the hemorrhagic one is definitely more dangerous, but it happens less often. Now, 700,000 people this year will have a stroke, unfortunately. The other thing that we need to be cognizant of is a TIA, which is a baby stroke or a mini stroke. The patient will still experience the same signs and symptoms as a stroke, but those symptoms will resolve usually within the first 15 minutes, but even within about 24 hours. So a lot of things that we're going to notice in a patient that has a stroke. One of them is a sensory deficit. You might look over and see that they're having a hard time formulating words or processing thoughts. You might notice a facial droop, and what we'll see is even whole side weakness on one side of their body, or whole side paralysis. So that can be left or right depending on what side of the stroke is. If it's a stroke on your left side of the brain, the right side will be paralysis or actually have that weakness, and vice versa. If it's on the left, then the right side will have that weakness. The other thing that we want to check and notice is the change in level of consciousness, noticing signs of increased pressure in their brain. That again could be caused by that bleed. Noticing changes in respiratory efforts as well. Now, when we get to the hospital, we're going to do one test, and the first test is a CT, and timing is everything. If I could encourage one thing, it would be that if you suspect a stroke, get them to the hospital, because that timing, they even say time lost is brain lost. So it's very important that we get them treated. Now when they get to the hospital, we're going to do this CT within the first 25 minutes. It's going to be read within the first 45 minutes, and we're going to be able to determine treatment from there. If it is a bleed, then we're going to have to do surgery and try and stop that bleed. If it is not a bleed, then we're going to do what's called fibrinolytic therapy, which basically helps break up that clot, which stops the blood flow blockage from the brain. Once we do those, again, there's other therapies as well we can use to try and remove that clot if needed, but that's our main goal, is restoring blood flow to the brain. So from there, if we have to, we'll treat that patient depending on their residual effects. Now we're going to assess their ability to speak, to focus, follow commands, check their pupils, check their movement, see their weakness, see really every sign and symptom that they may have, and treat them accordingly. We know with this it's going to involve a PT, an occupational therapist, a speech pathologist, the nurses, the aides, the doctors, a lot of disciplines getting together on helping these patients recover. As they recover, we'll see incremental improvement, but at a certain point, because that timing and lack of blood flow to the brain is so important, we're going to notice that that recovery stops and they're not able to actually get better from there. Once that happens, again, you have to make long-term adjustments to help them get through their day. Now, out of those 700,000 people this year that will have a stroke, we know 160,000 roughly will die, unfortunately. From the ones that are surviving, about 50 to 70% will have functional independence, obviously able to get around and through their day, but 30% will have permanent long-term effects. So again, these people are going to have those adjustments they're going to have to make in their life, and how they're going to have to adjust to their new living situation. But that really is the basis of a stroke and what's important as you're assessing somebody with a stroke: timing, treatment, recovery.
Thank you for watching A Wise Way. Subscribe to stay updated, share to pass the knowledge, or view our other videos on the left.